Good afternoon. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine, who answers your COVID questions every Wednesday on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be answering viewer-submitted questions and addressing the latest COVID headlines through today, November 23rd. We just invite you to submit your questions via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. Leading the discussion today is myself, Sophie Bukowski, a student research assistant with the Institute. So Dr. Murphy, I'm going to start with some updated COVID statistics.
Great. Thank you, Sophie.
In the United States, yesterday, we saw 42,220 new cases. Cases have been increasing about 7% over the last 7 days, but our 7-day average is still at about 39,000 positive cases, which is great, honestly, comparative to what we were last year. Hospitalizations were flat in terms of increasing or decreasing, and deaths in the United States have increased by 3%, but honestly, we're decreasing as of a couple of days ago. In Illinois, yesterday, we saw 2,088 positive new cases. Cases are increasing by 3%, hospitalizations are decreasing by 1%. And unfortunately, in Illinois, the death rate in Illinois is increasing by 19%. So what can you tell us about what these statistics mean in light of December being around the corner?
Well, the only numbers we can really count on here are the hospitalization and the death rate, because most people are being diagnosed with mild disease themselves with a home test kit. The NIH is just starting a website where people can voluntarily call in and say, I tested positive. That's
wow.
Interesting. But that's going to be a volunteer system. But there's way more cases than you're reporting, but they're not serious. And why is that? That is because 2/3 of the people at least are vaccinated. And many people have had COVID, and all that gives you protective immunity. So it's going to be very interesting to see what happens in the near future, as we expect the winter wave to come. But it's certainly good news that the death rate and the hospitalization rate continues to decrease. But still, at 300 deaths per day, that's over 100,000 cases per year.
Yeah, absolutely. So going into our first COVID headline that ties really closely into this is, will COVID boosters prevent another wave? And scientists aren't really sure. So what can you tell us, Dr. Murphy, about this headline?
Yeah. So the COVID boosters are the ones that are available right now are bivalent. They work against the old virus and the new BA4, BA5 variants and their subvariants. They work very well. They create even more antibodies than the original vaccine. And it's very critical that people take these, because it could save your life or keep you out of the hospital. It's not going to prevent you from getting sick, but it is going to prevent you from getting seriously ill in many cases. As I mentioned, the United States, the 10 states with the highest vaccination rate do much, much better in terms of survival with COVID than the 10 worst states. As a country, we actually rank 20th out of the top 20 countries. And I'm talking about population and wealth, the high income countries. So, we're already in last place in our peer countries, and the bottom 10 least vaccinated states are way below that. But the point is, the more vaccines, the more, and then you can split it down between who had the first couple vaccines and then who got boosted. The booster ones do even better. So please get your booster. Very, very important, and they work quite well.
Yeah, absolutely. Going into our second COVID headline is that China reports its first COVID-19 death in nearly 6 months as cases are spiking all across China. So what can you tell us about this 87-year-old man that died in Beijing the other day?
Well, China is finding out the hard way that their zero tolerance approach to COVID doesn't work. It's just too contagious, the virus, and they're never going to get zero. It's had devastating effects on their economy. People, I mean, are rioting in certain cities. They just can't take it anymore. And these strict COVID measures are not working. They've had over 26,000 cases since last Sunday. They just can't do enough, unfortunately. Now, they've got to do better with their vaccination rate, and they have to use better vaccines. But that's something that they're also capable and wealthy enough to do. It's their approach is failing, and this is just going to continue. This will never stop. It's going to go on forever until the whole pandemic just completely goes away. But that may never happen. If we're expecting that it's going to become like another flu and be endemic, China will never improve in China with this approach. So that's a big problem for them.
Yeah. And then going into our third headline, which ties closer into the flu, but it does have some effect onto COVID, which is that the flu variant that hits kids and seniors harder than any other strain is dominant in the US right now. So what can you tell us about how this is affecting young children and senior citizens?
So there's flu A and flu B, and flu A is the variant that's floating around now is H3N2. This is a particularly nasty flu. And it accounts for 76% of the respiratory samples that have been tested by the CDC. Young kids and senior citizens do much worse with this particular variant. And as we've said in the past, the flu came at least 6 weeks earlier than expected. It's very strange. It's normally starting right about now, and then picks up in December and January, really peaks. But we've already had 2,100 people in the United States have died, including 7 children. Hospitalizations for flu are at the highest in a decade, with about 8 out of every 100,000 people being hospitalized right now for the flu. This hospitalization rate for seniors is double that of everybody else. So it's not good. Now, the vaccine that's available for the flu this year, everybody should be getting it. It works about 50% of the time, which for flu vaccines is actually okay. But that has a huge effect on a population level. So if you just think, oh, well, it only works 50%, I'm not going to bother. You just add to the problem. And you're another person that gets the flu and then gives the flu to other people. So from a public health standpoint, it's 50% is still good, and people should take the vaccine.
Yeah. Going into, that goes so closely into our first and only COVID headline, which is how can one stay safe during the holidays? And obviously getting vaccinated and boosters and flu shot is super important. So what can you tell us about this?
Well, this is the holiday question, because what's going to happen this week with Thanksgiving is there's a lot of movement of people around the world, but in the United States, nobody else had Thanksgiving. So this is a unique United States issue. You got a lot of people moving from A to B and then back. So that is going to spread the virus, the infection, quite a bit. And it's going to be, unfortunately, interesting to see what happens before Christmas, if there's a bump up, which there will be. And then at Christmas time, especially the week right after Christmas, in the first couple of days of January, the same thing, people moving around, people going on holiday, people, coming back, going and coming, planes are full, you're in crowded airports, no mask mandates, nobody's wearing a mask on airplanes anymore. That's when this expected peak thing is going to happen. So it'll be after Christmas, but there's going to be a bump after Thanksgiving too. So what can you do? Specifically, you can just stay at home and don't go out, be a hermit. This is not very popular, and people want to get with their family, and they should. But And there are some things that you can do that will lower your risk considerably. Nothing's 100%, but it's all about risk reduction. And what can you do? So one is you plan around the highest risk person in your family group. If you have an elderly relative who's very fragile and sick, you've got to be super careful with that person. Yeah. They're going to have to be a little bit isolated from the rest and wear masks around them and be very, very careful. Now, if that's not the case, then you're a little bit more open with what you can do. So the biggest thing you can do is stay on top of your vaccinations. The new COVID bivalent vaccine and the flu shot. Go get your flu shot today. It's never too late. But stay up to date with your vaccines. That will have the biggest impact overall. Symptoms. If somebody is sick, they don't come. You don't let them in the house. It's just too risky. And besides the flu, and besides COVID, there's also respiratory syncytial virus, and there's a whole pile of other viruses, and they're all like swarming around right now anyway. So if somebody is sick, they got to bow out. Testing. Now, while the rapid tests, which are also called antigen tests, are good, they're not perfect. But if you're with a group of people for the holidays, if possible, you should be testing, and you're all together. You should be testing every day. You can now, if you can afford it, they're not free anymore, but it maybe every other day. So before you meet, test on that day. Maybe again the next day or the day after. There's nothing written in stone here. And if you can afford to do it, do it. Even if you can only afford to do one test, do the one test. You might pick up a person who's infected, because that person likely is going to spread it to everybody there. All right. When you travel, now a lot of people are not wearing masks on trains or buses or planes. And now's the time to wear a mask. Too much movement, planes are packed. You do see some people, I've been flying around lately, I'd say less than 10% are wearing a mask. But people I think are getting used to the fact that some people wear a mask. Very common in Asia to see before the pandemic, certain people just wear masks. It's kind of a cultural thing, and people are being more careful. We used to not think much about it, but now I think a lot about it. So if you travel now, it's a good idea to wear a mask. And the better the mask, the better. But any mask is better than no mask.
Yeah.
So masking. Then finally, ventilation. So the more very few of these infections are transmitted outside. Now, it's November. We're in Chicago. You're not going to be outside very much. Although the weather's is not supposed to be too weird this Thanksgiving Day, maybe in the 40s or 50s. That's great. But just increasing your ventilation in your house. If you can, keep a window open. Don't be in closed rooms that aren't ventilated well. Keep some air moving. Any kind of air moving is better than a stagnant airspace. So, none of these things improve 100%. But if you do all those things, you will have a relatively safe and happy holiday.
Wonderful. Well, Dr. Murphy, those were all of our COVID questions for today. We wish you all a happy Thanksgiving, and we will tune in next week.
Great. Have a great Thanksgiving, and we'll see you next week.
Thank you.